The patient is a homeless white male in his late 50s that struggles from substance abuse of cocaine and alcohol. In this video, I'm going to be discussing some health promotion strategies as well as some risk reduction strategies specifically for this patient. So when you're buying illicit drugs off the street, there's always a possibility that they're laced or mixed with other dangerous chemicals. In a study of 255 cocaine samples, it was discovered that 15% of them contained a powerful synthetic opioid known as fentanyl. Fentanyl is very potent. Even 2 milligrams of it could be lethal. So a health promotion strategy for this patient would be to give him a medication called naloxone or Narcan. It's a nasal spray that can help reverse an accidental opioid overdose. Another health promotion priority for this patient is to have immediate access to some sort of housing after release, preferably a treatment center, as it is well known that mental health illnesses coexist with substance abuse and they're further exacerbated by homelessness. Another health promotion strategy that would be beneficial for this patient is to connect him with various organizations that can help him find affordable permanent housing, that can help him with health care and food stamps, substance use treatment, and employment training. Another health promotion strategy for this patient is being prescribed a medication called naltrexone. So naltrexone is an agent that binds to opioid receptors in the brain that trigger the release of dopamine, which is the neurotransmitter associated with pleasure and reward. So by binding to those receptors, we can decrease the euphoria that the patient experiences from the alcohol drinking. And so by decreasing that, we can decrease his cravings and consequently help him maintain his sobriety. Another key aspect for improving overall well-being is risk reduction. So while health promotion focuses on empowering or enabling the patient to improve their health outcomes, risk reduction strategies emphasize on minimizing negative health outcomes by addressing modifiable risk factors. So cocaine use is a modifiable risk factor that the patient could focus on reducing or eliminating from his life. As cocaine is highly addictive, it is recommended that the patient would seek professional help to achieve abstinence. In a multi-center, double-blind, placebo-controlled study involving 302 individuals across the United States, it showed that there was a decreased cocaine use in the group that took a medication called Suboxone, which is a combination of buprenorphine with naloxone. And they noticed that specifically 16 milligrams per day dosage of buprenorphine, that group had less cocaine use compared to the placebo group. So although cocaine in itself is not an opioid, based on this data, it would be reasonable to place the patient on this medication as it could help him with his cocaine addiction. Another risk strategy for this patient would be to connect him with support groups. Alcohol Anonymous, AA, is a very good one. It is specifically designed for individuals suffering from alcoholism. This group consists of people who want to stop drinking and remain sober. It is based on 12 core principles or steps that help guide the members in the group into recover from their alcoholism. Furthermore, the members of the group encourage each other and provide hope to each other in their journey of lasting sobriety. Since the patient is an alcoholic, being a participant of such a group that focuses on sobriety would be very beneficial for him.